welcome, Ndlovu. Today I'm with Dr. Tatenda Chingonzoh and we're going to talk about cancer. Welcome, doctor.
Thank you.
First of all, can we start with what is cancer?
So cancer is the abnormal multiplication of cells that then go on to form a lump. And from this lump, these cells can spread to lymph nodes. And from the lymph nodes, they can throw seeds into the blood and spread to any other organ in the body.
Okay. And in Zimbabwe, what cancers are we affected with most?
So in Zimbabwe, the commonest cancers amongst women, number one is cervical cancer. Number two is breast. The commonest cancer among men is prostate cancer. But there are a whole myriad of other cancers, not as common as these three.
Okay. And children? Are there cancers that affect children?
Yes, there are a number of cancers that affect children, including neuroblastomas, retinoblastomas, and so forth.
Okay. So starting with breast cancer and cervical, which you said affect women, what are the risk factors? How would someone be able to...
Okay, so I think the biggest risk factor for breast and cervical cancer is being a woman. Although this is not to say that breast cancer does not affect males. It also does because men have breast tissue as well. So that's the biggest risk factor. The risk factors for breast cancer include things like hormonal replacement therapy, having your first child after the age of 30, having your menarche or your period beginning at a very young age, or having your periods ending at a later age. This is to do with a period of hormonal exposure, estrogen exposure. So the shorter the time you have exposed to estrogen, the lower the risk. Nulliparity, not having children at all, smoking, obesity, lack of exercise. So they found that the risk of breast cancer increases inversely proportional to your exercise. The more exercise you have, the lesser the risk. The higher the higher the exercise, or the lesser the risk, and vice versa. For cervical cancer, the commonest cause of cervical cancer is human papillomavirus, which is a sexually transmitted virus that's usually asymptomatic. And this one accounts for more than 80 to 90% of all cervical cancer cases.
Okay.
The other risk factors for cervical cancer include having multiple sexual partners or having a partner with multiple sexual partners. Multiparity, having many babies. Smoking is another risk factor, and other sexually transmitted infections like chlamydia and gonorrhea. These are associated with having also the higher chance of having HPV when you contracted those.
Okay. So internationally, you hear a lot about the HPV virus, the HPV vaccine, I mean. And do we have one locally available to Zimbabwean women?
Okay, so the HPV vaccine is available in the private sector, where it is very costly and not available to the average sort of person. But HPV vaccination has been recommended for girls from the age between 9 and 26. We have not had any exposure, not sexually active, meaning they have not had any exposure to the HPV virus. But Zimbabwe, I think, is working on ways to roll this out in the private sector, in the government sector as well. But we are not quite there.
Okay, and there's been issues with maybe feeling like 9 and onwards, maybe to 13 or 14 is kind of young, because it sets a precedent for for us expecting them to be sexually active. What do you think about that?
Okay, so they've actually done some studies concerning this, where it was postulated that if you give them HPV vaccine, you're actually giving them a license to engage in early sexual activity, but it has not been found so. Giving the vaccine at this age is most protective because you want them to build resistance to the HPV virus, so that should they incur it when they do become sexually active, their body already has an immune response against the HPV. So that age before they are sexually active is the right time to vaccinate.
Okay. So what prevention measures do we have as a country for maybe breast and cervical, both in the private and public, besides maybe a vaccine? Do we have any other measures in place?
Okay, so for breast cancer, there are a number of things that we can do as women and girls. Um, the first, which the West is sort of doing away with, but I think is still very applicable to us in Africa, what we call breast self-awareness. This is simply knowing your breast. It used to be called breast self-exam. They've changed it to breast self-awareness. So it simply means know your breast, know the shape, know your nipple, know, the color and all that. And so what this constitutes of means every month at about the same time, about 7 days after your menstrual period, you examine your breast for any lumps or any changes from about the age of 21. That's breast self-awareness. Further to breast self-awareness, you can have what we call a clinical breast exam. So this is where a healthcare practitioner examines your breast. Because this is more, we believe this is more likely to increase the pickup rate than you just examining your breast alone.
Okay.
And in the private sector, we have mammograms. There is a mammogram at Mpilo, but we have no radiologist. A radiologist is the doctor who then interprets the mammogram. So mammograms are x-rays that we take of the breasts, and these help pick up more than 60% of cancers or lumps before they're actually palpable. By palpable, I mean before you can feel it with your hands. So in the government, there is a mammogram at Mpilo, but the doctor to read it is not available. And in private, we have quite a number of mammograms all throughout the country. Mammograms are for women above 40, which is when screening for breast cancer starts. Then screening for cervical cancer, we have in the government sector, also in the private, but free of charge in the government sector, we have VIAC. So VIAC is visual inspection with acetic acid of the cervix. They put some vinegar on the cervix and see if there are certain changes. And with this, they're able to pick up precancerous lesions and other things and immediately treat, especially if the disease is early. The pap smear is available mainly in private. The reason it's not available in the government is the lack of the cytopathologist or the doctor who looks at the cells that are taken from the cervix to see whether there is cancer or not. But the VIAC for cervical cancer screening is available widely. It's cheap because it's free in government, and it's good in that they can see a lesion. If it's small enough, you are immediately treated, so you don't have to go and then come back for your result later on as you would have to with the pap smear.
Okay. What about prostate cancer? You mentioned the men have prostate cancer. What are their risk factors?
So the risk factors of prostate cancer, obviously the most common one is being a male. Being a man, yes, because you have the prostate. But other factors include actually being an African, black African man. So they've realized that prostate cancer is more common in black African men than in white men. Okay. And as well, black men are more likely to die from the prostate cancer than white men, because the prostate cancer in black men seems to be a bit more aggressive. Okay. The other risk factors for prostate cancer are age. So the older you get, the higher the chance you get prostate cancer. So I believe if everyone lives long enough, they probably will get prostate cancer. Mm-hmm. Factors like your diet, obesity, not quite proven, but I think a healthier diet would reduce the incidence of any of these cancers, as well as avoiding smoking. Okay. Because it causes a lot of cancers from the head right down to the toes. Smoking is a risk factor.
And what symptoms do they suffer? How might they be able to know that maybe this is the time for me to go and get checked by the doctor?
So they shouldn't wait for symptoms. Okay. So the idea in cancer is to catch it before it has any symptoms, early detection. So in early disease, there are no symptoms. And that's the best time for us to catch the cancer. Okay. Because the chances of cure are much higher when it's very small. So the other symptoms that can present include increased frequency of urination, especially at night, sometimes blood in the urine, pain in the bones, especially of the pelvis or the back. These symptoms are not specific only to prostate cancer. They can also occur in other conditions of the prostate, like where the prostate is enlarged, okay, or some infection, prostatitis. So the symptoms are not particularly, do not necessarily mean you have prostate cancer, but these might be some of the ways that it may present.
Okay, and then with breast and cervix, what are some of the ways that, I know you said we shouldn't wait for symptoms, but
Okay.
what are some of the things we might see that might make us rush to the doctor?
Okay, so for breast, a lump, usually hard, but any lump, needs to be investigated in the breast. There could be nipple changes, where the nipple looks pulled in or inverted, or it's like facing outwards or a different direction from the normal direction of the nipple. There could be skin puckering, where in a certain area the skin looks pulled in. There could be changes in color, some reddening, or in the areola, the black, the area around the nipple. There could be changes there. Under the armpit, you could feel lumps. But know that you need to know your breast, because some women, their nipples are naturally maybe looking in this other direction. That doesn't mean, so it's changes in the normal that will help you quickly pick up breast cancer. In cervical cancer, the commonest symptoms include a discharge, usually foul smelling, that doesn't resolve with antibiotics. It can seem to get better, but it will keep coming back. You could have bleeding. This bleeding could be intermenstrual, that's in between your period. It could be post-coital, after sexual activity. It could be just really heavy bleeding. It could be postmenopausal, so a woman whose periods or menses came to an end and then starts having episodes of bleeding. And then symptoms from if the cancer has gone to other organs, like in the lung and the liver. These are varied. Lower backache, lower abdominal pain. Again, having these symptoms does not necessarily mean you have cancer. Other things could cause these symptoms, but these are the common presentations of cervical cancer.
Okay. So Africans usually, we're known for infectious diseases. That's usually, people just think Africans just have malaria, HIV. What has happened in recent years that now we have things like cancer that were not attributed to Africa?
Okay, so there is an increasing amount of non-communicable diseases, of which cancer is one of them. And I think we could attribute this mainly to our diet. So we have westernized our diet, and we're now getting basically the diseases or the cancers of the West. So there's an increase all around of the non-communicable diseases. For example, the diabetes, the cardiovascular diseases and cancers, which were not a big thing when we used to eat our traditional fruits, the utes and all those, and bambaira was breakfast, not this white bread, for example. So I think diet is a big thing, and a big contributor to this huge increase to the cancers, as well as other things like HIV. Although with the control of the pandemic, with our good ARV program, these other cancers associated with HIV are on the decline. Okay. So I think these are the two greatest contributors to our increase in cancers in Zimbabwe.
Okay. And how do you think we're managing as far as the number of doctors that, because you mentioned that we don't have radiologists in some places, we don't have people to read certain things. So how are you managing, considering cancer centers, cancer doctors, screening, in mitigating the cancer, now that we have seen that it's going to be a problem?
Yeah, so that area is there is a huge deficit, not only in the manpower, but even in equipment. So for example, right now at Mpilo, whilst we're working on getting the machine up, but for the past 6 months, the radiotherapy machine has been down. So factors like this are bad, for our patients, for oncology patients. We also have very little in terms of manpower because of the exodus of our specialists and our professionals out of the country for greener pastures. So it's not good. Our screening programs, the VIAC program is I think, well established. We, I think, are a center of excellence or a country of excellence in terms of the VIAC. But in other areas, I think we are lacking. We don't have, a strong public sort of screening program for breast cancer. Prostate cancer needs also screening, which can be done by a digital rectal exam, where the doctor inserts his finger in the patient's rectum, normally done from the age of 45 in men as well as a PSA. But the PSA, again, is available mainly in private. It's a blood test, available mainly in private, and patients have to pay out of pocket. Also, I think another thing is just education and awareness. We, I think, are not doing enough to educate our people on these cancers and the screening and prevention measures. I think we need to go a bit further in educating our population. Because you see, most of the common cancers that I was talking about, that we're talking about, like cervical, breast, and prostate, these are sort of reproductive, reproductive area cancers. And in our African culture, we don't talk about that. So many women, when I'm talking about the numbers of women that are picked up, I think the National Cancer Registry estimates about 2,000 women, new cases of cervical cancer in the country a year. 2,000. But this is an underestimation, because this is those women who seek help, who seek help at the health facilities. What about the woman in the rural area who's having her discharge and she's told, it's the dead coming out of the uterus and so forth. So we need to do a whole lot more to address these issues, to talk about cancer, and so that we change our health seeking behaviors as Africans.
Yeah.
Like I was saying the other time, that, the thing with us black people, if it's not bleeding and if it's not painful, we don't seek help. And that's the amazing thing is, for example, for breast cancer, usually the lump is painless and it doesn't bleed. And that's the time when the patient should be coming to the health center. But because it's not painful and there is no blood, they won't. By the time it's ulcerating and it has a sore and it's bleeding and they're coming, the disease is very advanced. Yeah. So that's very unfortunate.
So we have managed with HIV and TB. We had really, really good campaigns for those. So what suggestions would you have then for the government maybe to take a similar approach to cancer with awareness and education?
So I think it comes back to funding and putting funds into the health system, into the health sector, because if we can't treat, for example, it's a problem. Because you want to educate people and then they come for treatment and the machines are down. You see? So we just need to equip the health facility first and then start engaging in community outreach programs, speaking about cancer at schools, in the community, educating even our traditional leaders, our traditional birth attendants. I know the Ministry of Health is trying to get the traditional healers in, because that's where most of our patients go initially before they come to the health center. And they are being treated. I'm not sure about the outcomes, because the evidence is never provided. But so it's getting all these people, these stakeholders on board, talk to them about cancer, educate them. Because once you empower the community, then you empower the nation. That's my belief. Yeah.
So you talked about traditional healers. What are your feelings concerning these alternative treatments? And not only traditional healers, but other things that maybe are done abroad. People are trying things like marijuana and things like that for cancer. What are you feeling about these alternative treatments for cancer?
Okay, so I'll talk about marijuana separately, but in terms of the alternative medicines, most of the drugs that we use, even for treatment in cancer, actually come from plants, So we might actually be harboring a resource. The traditional healers might be harboring a resource. But the honest truth is something that is not documented, something for which trials have not been done. And by trials, I mean clinical trials where you have your root, and this root is tested in people who are confirmed to have cancer, and the outcome seen, is very difficult. So, one, whether or not traditional healers are treating or are not treating cancer, we don't know. Because firstly, many of the patients who claim they have cancer, they have not had the biopsy. So a biopsy is where a piece of the lump is taken and the pathologist looks and confirms these are cancerous cells. So we don't know, firstly, when we get these claims that someone is treating cancer, is it really cancer? Firstly, And then if they are treating, are they really treating? So everything we do needs to come back to evidence-based treatment. So you see with how the West does with all these drugs that we end up using in Africa is they take, if they have some drug that they think might work, they take 1,000 women, give them this drug and see the response. And from that we know You know, if you give this drug in breast cancer, this and this will happen. But the unfortunate thing with the alternative medicines is we don't have the evidence. We just have testimonies of someone saying, I had cancer and this. So, you know, I don't know. I don't want to speak negative, but we need evidence. We need the traditional leaders to bring whatever their roots, you know, the researchers extract whatever chemical is there and have it tried and tested. You know, that's the only way that Africa will go forward. For marijuana has actually been shown to have benefits. You know, in some countries it's approved, medical marijuana, because it has been shown to actually stimulate the appetite. And this is necessary sometimes in the cancer patient who has got so many other syndromes causing, you know, decreased appetite. It also helps to manage vomiting, you know, and it helps many patients sleep well. So marijuana has some benefits. There are additional claims to the marijuana which are still being investigated, but for those three, you know, it has benefits. It's not a license for use in Zimbabwe.
Okay.
Yes, but in countries where it's licensed, it has benefits. So here, it's illegal.
Okay.
Yes,
I like that. You're like, don't try it at home. It's
yes,
illegal.
no, I'm not saying
Okay.
we go about and take marijuana, but I'm saying its benefits have been proven.
Okay.
Yes.
So you mentioned in black men, prostate cancer being more extreme.
Mhm.
How many studies do we do here in Zimbabwe locally concerning cancer? Or are we using most of our knowledge from maybe foreign studies and foreign written textbooks?
Okay, so increasingly, especially with the universities, the University of Zimbabwe and the NAS School of Medicine, for example, we are beginning to do studies in cancer. Our limitation, obviously, is funding. So where you can get grants or funding, mainly from the West, we are doing some research. Because, for example, cervical cancer, the greatest burden in the world is in Southern Africa, which is us. You know, so to get evidence and how to treat it from America would not be doing the disease justice. So we are moving along those lines, but again, it's a matter of funding because we have the volumes of the patients. We need funding to do more research on now with our own population.
Okay. So what can someone do to maybe mitigate their cancer risk? Just something you can do personally on your own.
Okay, so in general, healthy living, a healthy lifestyle, eating right, more of the natural foods, vegetables, legumes, that sort of thing. Going back basically to where we came from. So unprocessed rather than the processed food. That's like brown rice versus the white rice. Brown bread, if you must eat bread, versus the white bread. That sort of thing. Brown sugar, if you must have sugar. You know, but avoiding sugar if you can. So healthy lifestyle, diet low in fats, and lots of exercise.
Okay.
You know, and management of weight. Obesity is a risk factor in quite a number of cancers. So good weight management, lots of exercise, eat healthy, lots of water. These fizzy drinks are not good for us. Avoid smoking. So lifestyle change, I think, basically is what you can do as an individual. And then self-awareness and educate ourselves rather than being on YouTube and following, I don't know, whatever, comedy, you know. Learn, equip ourselves, you know, what are the risks, what are, you know, that sort of thing.
So there's a lot of health information online. There's a lot of websites, from very serious medical websites to something more casual. How can you tell, like, where you're supposed to read and how seriously to take something? Because so many people come and say, "Doctor, I think I'm dying," because they read something online, and you're like, that's not a real source you should be taken seriously.
Yeah, so Dr. Google is good sometimes and sometimes can be problematic, you know, because there's a lot. Even if I have my fake cure, I can just put it on the internet. But again, like I'm saying, it's your doctor should be your friend. Don't visit your doctor only when there's a problem. You know, your doctor should be your friend. You should be having annual health checkups. You know, as a girl, your sugar, your blood pressure, you know, and then the examinations that I spoke of. So your doctor, you should not be visiting your general practitioner only when there is a problem. Always have, you know, what I call a plan, a health plan. annually, just go, I need to go for my cervical cancer screening, I need to go for this, I need to go for, and then you can just lump that into one visit and visit your GP once a year. And this helps you, this helps you sort of iron out all the other lies and all this that you can get on the internet.
Okay.
And ask if you visit like Mpilo Hospital, for example, you go to health promotions department, and they'll direct you to the appropriate specialties where you can get help and information.
How important are genes to cancer? Because there's always people who think, well, I have a line of aunties that died of breast cancer, I'm next.
Yes, so it's very important. I think I must have forgotten that one. So approximately 10% of breast cancers are genetic. So there are certain genes that follow the family line. For example, if your mother or your sister, what we term a first-degree relative, has had breast cancer, you need genetic screening. This is not available locally, but it portends that you might actually have that gene which predisposes you to the breast cancer. So one of the things that you do when you've seen that sort of pattern is early to start seeking help from your doctor, and you can discuss, because sometimes your screening needs to be earlier than, for example, the 40-year you mammogram at 40, because you are at higher risk.
Okay.
And even for prostate cancer, for example, if your father is at prostate cancer, there are genetics associated that predispose. It's not a large proportion, like I'm saying, 10 to 20% of prostate cancer cases are genetic, but if your father and your brother and who has had prostate cancer, the risks of having it in you are much higher, as well as actually other cancers. So if your family history, not necessarily breast, maybe you have a family history, someone had ovarian cancer, someone had colon cancer, there are certain syndromes where you are predisposed to having cancer. So if you have that sort of family history, you need to seek help much sooner than the general population.
Okay. So in conclusion, maybe, can you tell us what other cancers you see as an oncologist here in Zim?
Okay, so the spectrum of cancers is huge and massive. With the HIV pandemic, so we have HIV-associated cancers, including non-Hodgkin's lymphomas, Hodgkin's lymphomas, other cancers in the reproductive area, anal cancer, vulval cancer in women, rectal cancer, colon cancer, lung. The list is endless, because basically any cell in the body can develop cancer. So from the brain, the head and neck, right down to the legs, so sarcomas and bone tumors and so forth.
Okay, and where can people go to get tested for any cancer they feel like they might have?
Okay, so I think your first port of call is your general practitioner. Yeah, your general practitioner will carry out your first physical examination, take a thorough history, and I think direct you depending on what the problem could be. It's necessary to remember that most of these symptoms, most of the time, are actually not cancer. So other things, for example, like actually a sexually transmitted infection, that's not cervical cancer, can present with a foul-smelling discharge, which after appropriate line of antibiotics will clear out. So your general practitioner or your outpatients department in the hospital is your first line of call.
Okay.
Yes.
All right. Thank you, doctor.
All right, my pleasure.
Thank you for joining us on this episode of Health and Living. I hope you learned something today. For me, Nomaqhawe, bye for now.